What if I told you there's a supplement that can decrease your chances of dying from natural causes by 25%? Would you be interested in taking that supplement? Such a supplement does exist, and it comes in the form of vitamin D. Let us take a closer look in this video. New research at the University of Southern Australia has concluded that people with low levels of vitamin D in the blood are more likely to die at a younger age than people who have normal levels of vitamin D. Vitamin D is a hormone/vitamin that we derive from the food that we eat and from the effect of sunlight on the skin. Not many foods contain vitamin D naturally, so most of our vitamin D is derived from what the body makes when our skin is exposed to sunlight and supplements that we may take. The most familiar function of vitamin D is the absorption of calcium and phosphorus in the bowel that the body uses to make bones. For people with low levels of vitamin D in the blood, in this study, less than 25 nanomoles per liter, the risk of dying decreased steadily as vitamin D levels were supplemented up until a level of 50 nanomoles per liter, after which no further benefit was derived. The researchers in the study examined the relationship between vitamin D and all-cause mortality, and specifically the relationship between vitamin D and cardiovascular disease, cancers, and lung disease. And the results of the study confirmed that there was in fact a relationship between the levels of vitamin D in the blood and the risk from dying from one of these. The same researchers found that vitamin D levels in the blood were associated with inflammatory markers in the blood, such as C-reactive protein, which is a molecule that signals the amount of inflammation in our body. In fact, they found that the lower the levels of vitamin D, the higher the levels of C-reactive protein in the blood. This suggests that by supplementing vitamin D, we may be able to decrease inflammation in the body. Research done in the past has already shown an association between inflammation in the body and diseases such as cancer, cardiovascular disease, diabetes, and arthritis. But is this the mechanism by which vitamin D decreases mortality? The answer to that question is still not known. But even though we still do not know the mechanism by which vitamin D decreases mortality, we can protect ourselves by making sure that we are not vitamin D deficient by eating lots of fatty fish such as salmon, trout, or tuna, by getting adequate exposure to sunlight, or if that is not possible, by taking supplements, 600 international units per day if we're between the ages of 1 and 70, or if we're above the age of 70, 800 international units per day. Just remember, too much vitamin D can be harmful. And I'm going to put a video up here that addresses this topic. I hope you liked the video. If you did, like, share, comment in the section below. Don't forget to subscribe to the channel. And thank you for watching. I'll see you in the next video.